so now we didn't have exactly the right size containers. For a face bath, which is what I'll demonstrate first, you want a basin maybe a little bit smaller than this, like a kitchen bowl. Plastic ones work fine, just kind of a round one. And you want to be able to get your face in, but not be so big that it takes there's a lot of extra water. So you need a little depth and not quite so big around. This one is more like a foot tub, but that's okay. Well, you can visualize, you can figure out kind of at home what you would need. Okay, and so what you do is we're going to say the hot water is in this one and the cold water is in this one. Now, I would have maybe 2 pitchers. I would have some extra hot water here, very hot water, and I would have another one for maybe some ice. And so when you get this set up, then you want to have a little extras on hand, because as you do this treatment, the water is going to cool a little bit, the hot will cool, and the cold will heat up a little bit. So you want to keep adding to that. And so what I would do first is get everything ready, and you've got a couple of towels on hand so that you can dry your face. Now, if you have a timer and you want to use that, you can, or you can just count in your head, which is what I usually do. But the face bath is a very powerful treatment if you have a head cold with a lot of congestion, or sinusitis, where maybe from allergies and you've got congestion in your sinuses. This is amazing. Now, we used to do a lot of overseas work. We'd go to the Philippines, and it generally knocks your immune system down when you cross that many time zones, because they're on the other side of the world. So usually when I got there, I would get a light cold, and then that light cold would turn into a sinus infection, because there's a lot of bacteria in there, and I would get that in. And so then I would end up with this terrible drainage. So on one trip, we were teaching at a training school, and I was teaching about 4 hours a day. I was very busy preparing materials. I got this sinus infection, and I thought, I'm just going to get well anyway. I'm not going to take time to do the hydrotherapy. You know, in some places it's a little harder. It's a little harder to heat water, to get equipment and all that. So I didn't do anything. And it got worse, and it got worse, and it got worse, and it went on for 2 weeks. And finally, I was so miserable, I said, okay, I'm going to figure out, get everything together and heat the water. One treatment knocked it out. One treatment. And I was really sorry I had waited 2 weeks to do that. But that's how powerful it is. Okay, so I'm just going to kind of demonstrate for you how to do this. You want to go in the hot water first, and you have to hold your breath. Unless you can hold your breath for 3 minutes, you have to come up and go back down, okay? And you have something like a little snorkel like kids play with. You could use a snorkel, so you don't have to come up, but generally I just come up and down. And so you gasp for air, go right back under, and generally count for about 3 minutes, 1001, 1002. That's the way I do it. And then you switch to cold for about 30 seconds. And then you would do these switches back and forth at least 3 times, but 6 would be even better. You can go up to 7 even. So I'm just going to show you. You want to get your face all the way in, so you go big gasp for air. And then you can start blowing bubbles out if you want, and then you come up, gasp for air again, go right back under, and then when you stick your face in the ice water, hold it for 30 seconds, if you can hold your breath for 30 seconds. And it's quite a shot going from the hot to the cold. If you have this really hot and this really cold, you may get some tingling feelings even, especially in the feet, but you can get that in the face too. And so what I would do is what I usually do to start with, to test this hot water, you want it hot, but you don't want to burn your face. You know, that's a sensitive area. So a lot of times I'll first feel with your hand and make sure that feels okay. But I kind of stick the tip of my chin in, okay? And just get that in, and then you just kind of gradually go in. And you can take it hotter as you get used to it. The face can actually take a lot more heat than you would think it can. It can take a lot. And so then you just go back and forth. And it's amazing now. You need to have, once you dry your face, you're going to need to blow your nose. If you have congestion, you're going to need to blow. So have something there where you can, a big handkerchief or Kleenex, whatever, because you're going to blow out a lot of junk out of there. It's amazing what will come out. But it's just really gets that circulation going in the face. And you could do this for an ear infection too. Just don't get your ears under. You don't want them to get cold in there. But from the face also, you're going to get the reaction with the ears to help kill out an ear infection. Now, if you have an eye infection, you probably wouldn't want to do this because if it's just in one eye, it could spread to the other eye. You want to be careful about that. So, anybody have any questions about the face bath? Okay. And so it's a pretty easy treatment to do. Now, you can also do this for your feet. And let's say you had a sprain. You sprained your ankle, and you've put cold on to start with for a few hours. Maybe the next day, wait about 24 hours, you could start a hot and cold treatment to your feet. And maybe I should just pull this chair around, and I can just, yeah, I can just show you from the chair. Let's see. I'm just going to pull this around. Okay. I think I can hold it on this treatment. Now, you don't have to get undressed for this treatment. You just want to make sure your clothes maybe come above the knees so it's not going to get them wet. I'm not going to take my socks off since we're not really using water, but you can visualize, okay? And you could do this for 1 foot, but since you're doing it, why not put both in? It's great for your feet. And so I'm just going to, again, just demonstrate here. Feet in hot water for 3 minutes, okay? And let's say it's been 3 minutes. You could use a timer. You can look at a clock. How long in the cold? 30 seconds. Okay, then I'm going to change to the cold. And, of course, you've got your pitcher again with hot and cold water. And you want to keep adding hot to that. You know, you can swish it around with your foot a little bit, add a little bit at a time. Cold, go back to the hot, and so forth. And so you can do this again 3 to 6 times. Amazing, the circulation. You're going to feel some tingling if you have that nice and hot and nice and cold. Now, if you're diabetic, you can do this treatment, or if you have poor circulation, but you have to have a thermometer probably. It'd be best. You don't want to go above 102 degrees in the hot. Now, with a person who has diabetes, let me tell you what the problem can be. First of all, with diabetes, you get damage to the nervous system. And so often, people with diabetes can lose feeling, and they can't tell how hot something is. And so you can burn them very easily if you don't measure the temperature. You can't go by how they feel. The other thing is that often the blood vessels are damaged in the feet, legs and feet of someone who's diabetic. And so the tissues, when they heat up, require more oxygen. So you put the feet in hot water, it's very hot, the tissues heat up, they need more oxygen, but the blood vessels can't open up enough to carry that oxygen that they need, and you can get tissue death. You can even cause someone to have an amputation if you're not careful. So hydrotherapy is very beneficial, it's very simple, it's very easy, but you need to be careful how you do the treatments and heed the precautions. And so the maximum temperature for someone who's has diabetes, I would say a maximum of 100 to 102, no, not above 102. I wouldn't put quite so much ice in the water either, maybe cool water, warm water and cool water, because cold also requires more circulation. And so you want to be careful, but that is still a good treatment that you can do. It's a good exercise. You just have to be very careful. If you're unsure how to do it, it's better to not do it if there's a question in your mind, okay? Okay. And so you could use this treatment. Let's say you stepped on a piece of glass and you got an infection in your foot. You could use this treatment for the infection. You could use it for a sprained ankle, for many, many different problems. You could use it for swelling in the feet, for edema, for whatever. It can be used as a simple treatment, okay? Are there any questions regarding the foot bath? Yes. You would want to be careful. If you have poor circulation, you would want to use the same precautions that you do for diabetes. Okay, now we've worked in other countries. Sometimes people don't know if they have poor circulation. Often they don't even know if they're diabetic. But one thing that you can look at, which is a pretty severe sign of poor circulation, is discoloration in the skin of the lower legs and ankles. I've seen people in other countries where it's just a blue, black, purple color, and maybe open wounds around there that are crusty. I would be very careful in working with someone that indicates very poor circulation in their feet. Now, if there are other things that you can do with the hands, it's usually not a problem in someone who's diabetic. Or if you know what a fomentation, just a hot, wet towel, you can put that across the thighs of someone who has diabetes and then change that with cold. And that will get a reflex action in the feet, but without the danger of actually putting the feet in the cold. Hydrotherapy is so amazing. You know, if you break one arm and you have it in a cast, you can do a hot and cold treatment to the other arm, and you'll get a reflex action in the broken one without even putting it in water. It's truly amazing. Okay, you could also do a sitz bath for people. Now this requires a little more effort to do this, but we've worked out a way at Butler Creek without equipment that you can do this. You know those big tubs that have rope handles? They're just like maybe between $5 and $10. You can get 2 of those, and let's say you had any kind of issue in the pelvic area. That could be female or male problems. You can do a sitz bath with hot and cold. And so you put hot in one bucket and cold in the other, and you can put a little stool in there that they can sit on. You may require a little help getting up and down. First we were using a sheet with a sling, and that works, but it's a lot more effort. I think a little stool works best. And you can do a sitz bath, and it's very easy. Now, I'm just going to, and then of course, when you take your feet out, you've gone through your changes, you just dry your feet off like you would with a face bath. But I want to tell you about a treatment for children also. We use this same treatment. We used to do this at Wildwood when I worked there. And when children have congestion or a cold, one of the best things that you can do for treatment for them is to get 2 buckets and do a hot and cold, and you put them in up to their neck. Now, those same buckets like you would use for a sitz bath with those big ones with the rope handles work very well for that. But if you have something smaller, you know, if it's a small child, but it's just amazing. Now, children don't like hydrotherapy, so it's good if you know somebody that has small children. It's good for them to start them out when they're very young, because as they get a little bit older, they just start screaming and you have to occupy them. But it is amazing, and I'll just give you a couple of little stories here. One is we were in the Philippines, and friends of ours had a daughter who was 2 years old. When we got there for that trip, she was sick, but she was getting better with some kind of congestion, cold, and so they thought she was better. And so they went shopping at the market in an open vehicle, and the cool air, it was the rainy season, the air was cool, hit her, and she got sicker. So we were out late. We were at the dock meeting some friends, and we got back home about 12 o'clock at night. It was about midnight. And they were still up with her. Her fever had gone way up. And in our terms, it was between 104 and 105, which was pretty worrisome to me. So we started praying. I said, Lord, what can we do? I can't go to bed with this child is sick. And so the parents were getting nervous. They didn't realize how high that was. But as I was talking to them, they got a little bit nervous. So I said, we tried another little treatment first, but it just, I couldn't settle her down enough to do it. So we said, okay, we'll do the contrast bath. And so we didn't have any ice, and there was no refrigerator there. And so they went to the neighbors to try to get ice, but the neighbor was already in bed. And so we had no ice. So we had tap water, it was cool. And then the father went to heat some water for the hot. Well, we had a little device you drop in the water that heats it. And it can bring it to the boiling point. But the father was very nervous, and he took that out and brought it before it was really hot. So we had warm water and cool water. Okay, and a very sick child. And then we put her in the hot bucket. She was screaming, and I realized that she was way too tall for the biggest bucket that we had. Okay, so she's up to her waist in this warm water, but that was all. And I said, okay, what to do? Okay, we can pour the water over her. So I ran to the kitchen to try to find something to pour over. Meanwhile, we're praying. I was praying in my heart the whole time. I said, Lord, show me what to do. And so they had every container was full of something except a little cup. It was a little teacup type thing that was plastic. So I brought that back, and I just started pouring that water over her with her screaming wildly. Her mother was trying to restrain her. I think we kept her in that warm water for about 2 minutes, and I said, okay, change her to the cold. She's just going wild here. So we put her in the cold. She was very mad, and we did the same thing with the cold. We went back to the warm water, and just a short warm again, poured that over, put her back in the cold. And by that time, she was so angry, I was afraid that it was going to be more harmful than it was good for her. So I said, just take her out. So her mother took her out. She took her, put her in bed, dried her off, put her in bed. The child immediately went to sleep. 5 minutes later, she took her temperature, and it was normal. That was a miracle of the Lord. And I've seen those kind of miracles in the mission field. When you have a great need and you call upon the Lord, just use these simple remedies that you have. The Lord blesses in a mighty way. Okay, all right. I'm going to end here. And thank you. I'm going to ask Lou to go ahead and come up and set up and help me move these things. Thank you.